Hi, it's a pleasure to be here, and I must plead the generosity of the hosts who invited me, because I'm probably the least expert person in the room on the ACA. So I've done a lot of work globally and not on domestic health reform. But any case, I wanted to talk about a couple of points that do bear on concerns about equity and the ACA, at least as they've arisen in my understanding. What I wanted to start with is a general remark. I know there are a number of economists in the room, and some have already left, some of my colleagues. But I just wanted to make a point that the word efficiency, which is often used in the context of health reform, keeping costs down but making the system more efficient, in my understanding of it, should be understood primarily or in addition as an ethical concept and not simply as an economic notion. Because, and this is the simple intuition that I want to emphasize, is that what needs we can meet with a given level of resource input will depend on how efficient a system is. So I don't want these, we often talk about an equity efficiency trade-off, and I think this is an important issue to grapple with, but I also think that we ought to harness the notion of efficiency to concerns about equity and the meeting of population health needs. A second point I wanted to make has to do with the mention of dimensions of equity that show up in the ACA. I believe in the morning session there was a good deal of discussion of the inequity between mental health problems and physical health problems, and the ways in which that's addressed downstream or soon to be enacted parts of the implemented parts of the ACA. One of the other pieces that was not referred to very much is also connected to concerns about equity, and that is the prior conditions consideration. So this is a piece of the ACA reform that is yet to be fully implemented, and when it does come into play, it's going to introduce or reintroduce into the whole system a kind of equity between the sick and the well. That is, it's going to eliminate the timing issue about when a particular condition arises and what access to care you have when that happens. One of the fundamental features in my understanding of health insurance is that it does want to pool risks across the well and transfer resources to the ill. And you can't do that in a proper way if you have these exclusions of people with prior conditions. So, but I see this as largely a question about equity, despite the remarks that were made that the American public doesn't agree with me, so, or doesn't understand the issues. What I wanted to talk about primarily today are not the points that I've just very briefly touched on, but rather two issues that I think have a central bearing on the project of the ACA. So one is who gets covered and who gets left out. So one of the largest groups that gets left out of the ACA are the group that we call undocumented or illegal immigrants, or I will refer to them as unauthorized immigrants. So one of the points I want to make is to review some of the considerations that would be involved in thinking about that exclusion. And the thrust of what I want to say is that is not a political set of comments. I'm not making a remark about what was politically feasible in including them or excluding them, but an ethical consideration: should they have been excluded, or should there have been an automatic assumption that unauthorized immigrants were excluded, or to be excluded. Second point, and I'll come to that more briefly, has to do with the whole concept of affordable insurance. How should we understand the notion of affordability? And one point I wanted to make is that these two issues, both the immigrant issue and the affordability of insurance, are issues in which I've done some work collaborating with some health policy PhD students, both of whom have successfully defended their theses in the last year. And I will be referring to work on the unauthorized immigrants as collaborative work I did with a woman named Karen Ledeen, and on the affordability of insurance on work that I did with Brendan Saloner, who's another graduated last spring. So I already said that. So let me talk about the issue about unauthorized immigrants. A central question in the whole idea behind universal coverage or expanding coverage is who should be included and who should be excluded, if anyone. So what is the basis of inclusion or exclusion? One possible line of argument you might have is to say that, and this is an argument that comes from some views in the global justice domain, basically says that there should be such a thing as open borders. We shouldn't draw lines between authorized and unauthorized immigrants, that we should have open borders, anybody can come. And you might think back to 19th century or early 20th century America as a place that didn't exclude any immigrants. I feel fairly empathetic towards that period because that's when my mother arrived as a Russian-born immigrant, and my father arrived and was born 3 months after the boat that he traveled on came. So I tend to identify with immigrant groups as a first-generation American. So the picture that I'm responding to is that I don't actually believe this open borders view. I think it fails as a requirement of justice, social justice. And so what I will want to sketch is a line of argument for including unauthorized immigrants that doesn't turn on this appeal to the open borders argument. The main point I'll make about that is, or I'll allude to it, and I can refer anybody who's interested to a written article about it, is that the open borders argument strikes me as fails as a requirement of justice because it's not sustainably feasible as a requirement of justice. In thinking about social justice, we often will take something we can't do or don't know how to do and say that's an unjust practice. But sometimes we will look at the inability to put in place a practice to replace it and say what this means is that it can't be a requirement of justice that people or institutions be designed in such a way that they are not sustainably feasible. So we don't have a good systematic discussion in the normative literature about which of these stands to take. And the picture I'm adopting is one that says, in order for something to be a requirement of justice, it has to be something that if people were raised in institutions over a period of time that abided by this, they could sustain the practice or the institutional design. And I don't think open borders fits that description, because I think you would find reasonable people organizing to close borders or regulate them in certain ways when their livelihoods, for example, were threatened under certain conditions. So I don't want to ascribe to states the power or authority or deny to states the power or authority under any conditions to regulate borders. And if I did want to do that, the whole problem of unauthorized immigrants would go away. And I don't want a simple or quick solution to that problem. Well, let me just mention that there's one other line of argument you might adopt, which would look like it could win that case right across the board. Namely, if you could say that people have a human right to health care, and there are international covenants and treaties affirming a human right to health. Well, the open borders argument is not part of that discussion. And that is because it's not acknowledged in anywhere in the human rights literature that there's a right to immigrate. There's only a right to migrate, to leave a country that you are in, and not a right to go to any place you want. It's up to states to accept you, and then maybe you can immigrate. Now, should that be the case? Well, I think that under certain conditions, states should have the authority to regulate the flow of people in and out of their borders. Not in all conditions, and I don't want racist or ethnic exclusions of people from states. I think that would be unfair and unjust. So if one turns to the Committee on Economic and Social and Cultural Rights, which makes declarations about the content of a human right to health and among other human rights, they don't say anything explicit about unauthorized immigrants. So I can't turn to that body of literature and legal thought to try to find an answer to this. So let me give two arguments. The first of which I think is pretty limited, and the second of which is the one I would want to emphasize more. But the first of which is an argument in favor or of a presumption for inclusion of unauthorized immigrants, and it's an argument from reciprocity. Reciprocity is a principle that many people adhere to. It basically says if you've contributed to a cooperative scheme, then you ought to be able to derive some benefits from it. It's pretty vague what benefits and how much. And maybe if unauthorized immigrants are simply here, that's benefit enough. So you might say this is an empty notion of reciprocity. But I think working and paying taxes, which is true, and we have empirical evidence to suggest that it's true, that's the contribution that many longstanding unauthorized immigrants make. And if that's true, then denying them some share of collective benefits would seem to be a denial of the principle of reciprocity. And I'm suggesting that that principle would support the appeal that, or the presumption in favor of including them. Second argument in favor of presumption for inclusion is a little harder to support, but I think it's more powerful if you can. And this basically suggests that in addition to paying taxes and working and so on, most, and I again emphasize I'm talking about most unauthorized immigrants should be recognized as members of the community. They do a lot of things that other members of the community do besides work and pay taxes. They are buy houses, they belong to churches, some belong to civic advocacy groups. They send children to schools, they rent houses or buy them. They are participants in many of the dimensions that other members of a community are participate in. And so I would argue that we ought to think about unauthorized immigrants, long-standing ones, as members of the community. And then we come to the normative part of this argument. So the first piece is simply descriptive. Are they members of the community? If we appeal to certain theories of justice and social justice, which would argue that all free and equal, for example, citizens of a society should enjoy certain principles that govern fair terms of cooperation among them. They might, one such view, John Rawls's, supports the idea that included among these principles would be a principle protecting fair equality of opportunity. And I think if you ask most Americans whether they support that idea, depending on the framing of that question, you'll get different answers. But I think a broad range of people will, in general, support the idea that they think the society stands for giving people something like fair equality of opportunity. So let me make the assumption that I take that to be one of the fair principles that we ought to think of as one of the fair terms of cooperation for all members of a society or members of a community. If that's true, and if health and health care being protected in various ways by population-oriented and individual medicine protects the range of opportunities open to individuals, then I think we have a basis for saying all members of the community should share in this fair term of cooperation among its members. There's a problem with this argument. The problem is the same theories of justice that want to distribute benefits to people in these ways will also suggest that people should have a political voice. They should have political participation rights. Am I claiming that in articulating the grounds for community membership and therefore for inclusion in health protection in a society, for example, being able to get insurance through the ACA, that individuals should also be made citizens and have a voice, political voice? I guess the view I have is that we can separate the concern about the route that people follow or have available to them to get voice, that kind of political voice, and the benefits that they're entitled to. We could separate them, provided we can say we ought to have immigration reform that includes granting longstanding undocumented immigrants an opportunity to have that voice. I think that is one of the central issues that we face in thinking about immigration reform now in Congress. So I would view the argument I'm giving as strengthening the case for extending both benefits, but perhaps dividing the labor involved, so that if we have a benefit like health care that we are distributing to other members of the community, we ought to also include longstanding undocumented immigrants. Now, that's I've given you two arguments presuming that we should include undocumented immigrants. Yet we hear in the public discussion a lot of claims about reasons for excluding them. And I wanted to suggest I don't think any of these should carry the weight that they do in that public discussion. One is an argument that there's criminality of some, people who are unauthorized immigrants broke the law. Well, I remind you and others that we, in fact, don't withhold health care from people who are violent criminals, committed rape or murder and are confined. And yet we're taking people who we think committed a misdemeanor, which is legally how the immigration laws are viewed, and we are denying them an actual benefit that we provide to people who've actually harmed or killed other individuals. And it strikes me that that is an anomaly in our practice, and it suggests that there's a distortion in the way we think about the criminality. The mere fact that there's no legal obligation to provide these services, and people will sometimes cite the 1996 law, the PR Aurora. I don't know if I'm pronouncing the acronym correctly, but there was a personal responsibility law in 1996 which established the legal difference in access to benefits between legal and unauthorized or illegal immigrants. Legal immigrants had to wait 5 years to get these benefits, but unauthorized immigrants don't get them at all. And that's what the ACA basically assumed was or treated as the law of the land. But what I'm raising is an argument about what the law should be and not what it is. And so my claim is that we ought to modify that law or change that law and include unauthorized immigrants in these benefits. Another argument that's sometimes made is that we don't want to provide incentives. But there isn't strong evidence that people react to these incentives to come here for certain kinds of benefits. So let me give you one example. The militarization of the U.S. border starting in 1993 preceded NAFTA by a couple of years. Prior to NAFTA, the immigrants who were unauthorized in the U.S. came and went. They came and worked, and they often returned. We had about 2 to 3 million unauthorized immigrants in the population. A decade later, we had 12 million. And that's the group that's officially excluded from the ACA. At the same time, or within a couple of years, we passed NAFTA, and that increased the flow of impoverished Mexican farm workers into the United States by hundreds of thousands every year, so that they became a big part of the flow of people who later became unauthorized immigrants once they crossed this militarized border. If we had since we had denied benefits at roughly the time that the NAFTA was passed, if there was a strong incentive to come to the U.S. to get benefits, you would have seen a decline in the flow of immigrants. Instead, we saw an increase. So I would infer from that we have pretty strong evidence that people weren't responding to these incentives. And that argument, in my view, has no empirical basis. Now, there is a cost, but it's, in my view, not an undue cost. There is another claim that is sometimes made that we give unauthorized immigrants, as we give everyone else, emergency care, medical care. Isn't that enough? doesn't that meet the concern to provide collective benefits that protect equality of opportunity, as I argued, to this population? Well, we all know that there are serious problems in drawing the line between emergency care and non-emergency care. And my view is that this is not a policy decision that we want to make, namely to say we're going to rest very heavily on this emergency provision and the denial of access to insurance. Even, I might add, access to purchased insurance through the insurance exchanges, let alone towards federally subsidized Medicare. The last point I want to suggest might have some merit. Not this emergency care, but it's not on my overhead for some reason. I think I cut it off by accident. What about impact on other vulnerable groups? Sometimes the argument is made that allowing in unauthorized immigrants and encouraging them to stay with the provision of medical care and so on would, in fact, help to take away significant goods from other vulnerable groups like low-skilled workers who they compete with for jobs. I want to suggest that there has to be some sort of consideration of the evidence for that. I think there's a mixed bag of empirical evidence around the impact on the wage levels or access to jobs of low-skilled workers, domestic workers. And so I think that one has to think through whether there is such strong evidence in favor of this competition that it would warrant denying this kind of a benefit to this population. I don't see that in the evidence that we now see. So let me, in the last couple minutes I have.
We're already 4 minutes over.
Oh, really? Are you? Okay, well.
The red line is flashing.
Oh, I was reading that as I had 4 minutes left. I see. I now look at it and see it's going up instead of down. Okay. Well, then I won't say anything about affordable insurance. My apologies to you for running over on the other material. But.